have all my supplies. We'll pretend I have my provider orders, and then Alyssa's recording. Knock, knock, I'm Hannah. I'll be your student nurse today. I would privacy and perform hand hygiene. Can you tell me your name and date of birth?
Joe Smith, 10-5-53.
Do you have any allergies?
Nope. Oh, wait, cell phone.
Okay. I'd go ahead and verify on his wristband. And looking at provider orders, Joe, it looks like I'm here with doctor to place a chest tube and place your dressing on and connect you to suction. Do you have any questions before we get started?
Nope.
Okay. So I'm going to go ahead and gather all of my supplies and get my tape ready. So I need 2 pieces of pant tape. And then 2 longer pieces. We'll pretend that's a little longer. Okay, and then I have the rest of my supplies here. So now I would go ahead and I'm gonna grab some gloves and I'm gonna raise the bed to a working height to get started. Okay. So, doctor's already placed the chest tube, so now I'm gonna go ahead and get Joe connected to suction. So, it is long to living, so keeping this sterile, I'd take the cap off and connect there. And then I would go ahead and turn the suction on to continuous, and it's within range, and then I'd go ahead and connect it to the chamber, and it is a dry seal chamber, so I connect it directly to it. And then I would go ahead and I'm gonna put the pant tape on. And then do the opposite direction with the pants and wrap it around. And wrap it around. And then I'd go ahead and take the clamp off. So now that Joe's connected, I'd go ahead and take my gloves off and perform hand hygiene. And now I will go ahead and get my sterile field set up. So I start off by opening it away from me and then only touching the 1-inch border. Okay. And then for this video, we'll save that these are all intact. I'll go ahead and open this. And then I'm just going to drop it on. And the split sponge, I'd go ahead and open and drop back. And then I will go ahead and also open my petroleum gauze. And without touching the inside, I'd go ahead and open it. And not touch where it is sterile on the inside. Okay. And then now I'm gonna go ahead and get my sterile gloves. I'm just gonna drop that for now. And again, only touching the 1-inch border. And making sure I'm not turning my back on my sterile field, I'm gonna go ahead and put my gloves on. that they're on, I can go ahead and adjust, only touching the sterile part. And keeping my hands above my waist. I would not have this curtain so close and keeping this sterile. So now I'm gonna go ahead and move everything, get my sterile field ready. Staying within that 1 inch border. And now I'm gonna go ahead and grab my pickups and place my hand within where it is sterile here. And I'm gonna pick up my gauze. Okay, so since this is still sterile, I can go ahead and put it back on my sterile field. And then I'm gonna go ahead and step back and properly adjust the petroleum gauze the way I need it. Okay, so now I will go ahead and grab my sterile pickups, and I'm going to sacrifice this hand at this point, and I'm going to go ahead and, without turning my back on my sterile field, I will go ahead and place the gauze, and only touching the top side to adjust it. Now that I have that, I'm going to get rid of my pickups because I no longer want them. And then I'm going to go ahead and grab the split gauze. And I'm going to go ahead and drop that on, and only touching the upper side. Adjust, and then again, going to grab my other split gauze and drop it on. So then now I will go ahead and grab my 4x4 gauze and place it right on top there. So now that I'm done with the sterile field, I can go ahead and get my sponge or foam tape to secure the dressing. And we need about 3 pieces for this. And it is starting to lose its stick because we've been using it. So if it was on a human and if it was new, it would be sticking down to the patient. So then I would go ahead and label date, time, and initial, and you'd be covering the whole thing, and it would be secured down to the patient. And then I'm also gonna, for extra securement, I would take the other tape I have left and secure it to Joe. And again, it would stay if it was a human. Okay, so, and this would still be connected if the tape was not previously used. Okay, so now that I've labeled date and time and initialed that, I can go ahead and take my gloves off and perform hand hygiene. I drop that into the garbage. And now I'm going to go ahead and do some of the assessments that would need to be done. We would assess the dressing for any drainage to see if it needs to be changed at all, and then I would also be looking at for any subcutaneous like air under the skin, subcutaneous arrhythmia, and then I would go ahead and check the tubing, and the tubing I'm looking for that it's intact and has good connection, looking for any clots or kinks in it, and making sure that there's no dependent position and that it's flowing properly. And then I will be looking at the chamber, and you would always keep this below the patient, but for the purpose of the video, I'm gonna lift it up. So I'm looking at this chamber here is the drainage container that you would be looking at, the drainage type for Joe. We'd look at the amount, the color, and the type of that. And you would be checking his vitals and assessing this every 15 minutes for the first 2 hours. And then going over to the water seal chamber, this you would want at the appropriate line, which is usually 2 centimeters, and you're watching to make sure that there's no vigorous air bubbles in this, and that you're only seeing titling, which would be it going back and forth as the patient breathes. If there was air bubbles, you would go ahead and assess starting at Joe down the tube, clamping to see it where you can see the leak. And then since this is a dry suction control, it's controlled up here, so you have it set to 20. And then to make sure it's appropriately working, this would float up and you would see it, the little red nodule thing. And then this right here would also say yes to make sure that it's the negative pressure indicator is working. If it was the wet chamber seal, for the suction chamber on the other one, you would be watching to make sure that there's appropriate level of water, and then watching to make sure that it's only bubbling as if the patient was coughing or anything like that. All right, Joe, is there anything else I can do for you today?
Nope.
I perform hand hygiene and clean up my supplies.